We get to Christoph Alexiou from Xeon Lab in Erlangen. Yeah. We'll talk about an imaging modality that you have not heard before yet at this meeting, I guess, magnetic particle imaging.
But there are two experts here, like you and Professor Fabian Kiesling. Maybe you can help me if I have some problems in introducing the physicist part of this magnetic particle imaging. Okay, so magnetic nanoparticles are already used, as we have heard, for biomagnetic cell separation, and as you know, for MRI imaging. We have heard this a lot. The thing is, magnetic particles can cause signal loss in MRI, and this is already published in 2001 by Harishinghani. It's one of the largest patient trials where people suffering from prostate cancer had an imaging before the operation with and without nanoparticles and with magnetic nanoparticles. The same radiology team in Boston and in Amsterdam, I think, are able to detect 95% of a malignant lymph node. This is very essential, especially for physicians like, for example, me. If you do know in advance how many lymph nodes are positive or potentially malignant, due to the fact that you can then minimalize or extend the surgical approach. And in terms of prostate cancer, the adverse side effects like impotence or incontinence is very high. So therefore, everything what is bringing to knowledge to the surgeon to minimalize the surgery is beneficial. Now, we are synthesizing in our lab in Erlangen particles, iron oxide nanoparticles, which have on the surface albumin. And what we could see there, if we do apply, we are normally doing therapeutic application, magnetic drug targeting, applying the particles with the iron oxide nanoparticles with the albumin surface, and in this surface chemotherapeutic agent are applied. And what we could see is, since we are able to do a library of particles, we created particles which cause also in T1 a signal loss before and T afterwards, you see. But normally the T2 signal is the right signal for detection of the signal loss of the particles in biological tissues. Now, this is just the introduction. Magnetic particle imaging was not introduced, I think, at CLINAM in the past, but was first mentioned by Gleich and Weizsäcker in 2005. This is a method to detect the distribution of magnetic nanoparticles in a certain volume, and it's different to MRI because in MRI, the influence of the respective material itself, for example, protons, are causing the MRI properties necessary to detect or define the tissue. And in MPI, the magnetization of magnetic particles gives the information for location and concentration. Now, this is now the arrangement. There are different magnetic coils, and magnetic coils are causing an oscillating magnetic field, and the particle respond in a nonlinear change. And this nonlinear change of magnetization can be detected, and this is one signal. But if you want to have a specific signal, then you have to generate a selective field, a field-free point, field-free view, and this is caused by a second magnetic gradient, which is superimposed to this gradient. And there you have a field-free point, and particles which are close to this field-free point are contributing to the signal, whereas particles which are far away from this field-free point are in saturation and don't cause a contribution to the signal. Now, since this is really a preclinical device still, the German Research Foundation decided to spend around 50 million euros to install two of these MPI devices. One was installed in Hamburg, and one is installed in the Charité in Berlin. This in Hamburg is already working. In Charité in Berlin, they are solving some problems. And as I know that Fabian Kiesling has also one, not installed already, because I think it's due to the fact that you create a special infrastructure in your lab. But this was really one of the first things that the DFG said, this is a very new field, and we want to have the advantage we have in Germany, especially concerning particle imaging. We should support this. And so therefore, Professor Wanka did introduce this in 2015. Now, these are now, this is spiral where you can see a phantom, where you can see these particles detected by the MPI signal as described before. They use it already in animals, especially for cardiovascular application. And you can see here, this is no animal seed. You only see the particles. You don't, with MPI, you see only the particles. You don't see any body compartments, and you have to overlap this with an MRI so you can then localize where the particles are. You can detect the particle with MPI, but you can orientate, or radiologists can orientate this, and if you do have in parallel also a magnetic resonance imaging. Now, the problem is there's a lot of efforts done concerning the MPI device, but since the respective iron oxide contrast agent like CNIREM or Resovist or ENDREM are not on the market anymore, I think it was in our lab we tried now to synthesize nanoparticles as we do and to compare this to Resovist. As here you can see we have a different coating. It's albumin, fatty acid coating. The diameters are approximately the same. The hydrogen diameter is a little bit higher, and the total ion concentration is also a little bit lower compared to Resovist. We have in Erlangen the possibility to do this also in a GMP manner, and we tried now to synthesize these particles. And as you can see here is a co-precipitation of iron chloride. Normally we use this here for drug targeting, but we thought, many people are mentioned this today, to do theranostic, therapy and diagnostic in both, since MPI is a potential imaging technique to really visualize the particles. And what we are doing here, you can see the particles, they are surrounded with serum albumin. Normally, as I mentioned before, for drug purposes, we apply there in the surface mitoxantrone or another chemotherapeutic agent. We have here the GMP unit because we are very lucky in Erlangen. This is the only university hospital in Bavaria which has the utility to produce pharmaceuticals by themselves. And we have there a small unit where we can produce these particles by our own concerning the GMP manner. We did also stability tests, of course, which are necessary to apply this once upon a time in human beings, for example. And since the fact that we can do the particles, we did also investigation in the blood stability, which is an essential issue. And with the coating of the particles with albumin, we could stabilize them, as you can see here, for at least 72 hours. Now, these are the synthesis and what the particles are used for. These are the first pictures done in Hamburg with Professor Knopp, who is running this MPI. We sent the LA-BSR particles to them, and we did not know in advance what will happen, but we were really, everybody was surprised and happy that we could generate a signal. And if you compare this to Resovist, especially in the lower frequencies, it's not so bad in comparison to Resovist because the gold standard right now is still Resovist. This is done in a while, and what we did then is we injected the particles in biological tissues here in liver and muscle, and we could also detect the particles here in the tissue, which is essential that we have visualization in vitro and also in biological tissue. Now, these are pilot experiments, since this apparatus is not so common in Germany at the moment, but I think it will increase. Serum nanoparticles, as I mentioned before, is visible in MRI. MPS measurements has to be done before MPI signal and is comparable to Resovist in our study. We did MPI studies in vitro and in organ tissue, and they are visible. And further studies, of course, have to be performed concerning the possibility to quantify. And this is, for me, essential to quantify the particles in the respective tissue, to have a non-invasive method to detect the particles, for example, in cancer, to have some control tool. And an outlook in humans might be for MPI that there is no radiation, no iodine, and especially if you do a half catheter, you have to use contrast agent like iodine. And the big problem in this is that often elderly people with kidney failure have to receive a catheter, a heart catheter, and with the potential application of MPI, you can reduce nephropathy in this imaging tool potentially. Now, I would like to thank the people, the organization who support us. And as I mentioned before, we synthesize particles, characterize, make in nanotoxicology over the operation theater. We want to do GMP production. We do this already and want to do clinical trials. I would like to thank also my team. And if somebody is interested, together with Bengt Fadel, we published in BBRC a special issue in Nanomedicine covering also the broad spectrum of the application of iron oxide nanoparticles. And if you're interested, just feel free and we can have a copy outside. Thank you very much.
Thank you. Questions?
Maybe I open the discussion. So we currently have the Weizsäcker system also already running and do experiments at Bruker also with that system. And I often hear the people comparing the new particles with ResoVist as some kind of gold standard. But the problem that I see is that in contrary to the promises that were given from the physical calculations, we do not get better than 1 order of magnitude, or maximally 5 orders, or factor 50 better than MRI with respect to sensitivity. So that means that these picomolar or nanomolar sensitivity that was originally promised from MPI was never reached in vivo. Yeah? And so the question is, do you have a strategy to reach that? Because without that, the modality will have really big problems to establish itself in clinical routine.
From my point of view, as a physician, you're a radiologist, I think everybody's talking about quantification of particles. And for me, beside the fact what you mentioned before is, for me it would be essential to have a non-invasive control modality, how much particles I can transport with iron oxide nanoparticles to a certain body part. And I think that with MPI, I'm much more, let me say, it's much easier, it's more possible to really gain quantification. Because the trials we do in Erlangen or with radiologists there, to have quantification of an MRI, it's not so easy, especially if you have a high concentration of particles in a certain body compartment, then you have an overload and you cannot quantify. And so therefore, I think in this term, MPI, for this approach, I think it might be very interesting.
Yeah, one more.
If I may directly answer to that, but what is then the real clinical indication? Because we also thought about that a lot. If you think about molecularly targeted imaging with 60 nanometer large particles, this is hardly possible and will never be superior to PET and SPECT. Yeah? And then if you take that out, then you compete, of course, also with the contrast-enhanced MRI and CT techniques for interventions and for angiography. There I see a chance because you may get rid of side effects, but this would demand that you really can decrease the dose to a level that is really non-toxic, which would again raise the concerns with the lack of sensitivity as it is at the moment. So do you think one can overcome that? Because I think this is really the crucial question.
Yeah, you're absolutely right.
For the modality.
But I think we are in the very, very beginning of this. And I think if you're talking with people in Berlin or in Hamburg or whatever, or with in Colony in California, there are people who are supporting and say this is the best solution. But okay, this is the main topic. On the other side, I think both, and this is one of the issues I also wanted to announce today, is there are people who are producing the MPI machine, on the other side the particles, and they both have to bring together to really to increase the sensitivity, because there are a lot of problems not solved at the moment. And if you don't communicate, and especially for Bruker and Philips, if you don't communicate, if you have only ResoVist as a standard, you won't be able to really transport this, as you mentioned before, into clinics and to really show the benefit of this new technique, according to my opinion.
Okay. So I don't see any more questions. Thank you again.
Thank you very much.
Very much.